I'm tempted to ask if there's a doctor in the room or a nurse practitioner, more importantly. Even in today's fractious times, as Victor pointed out and as the governor has pointed out, we can't lose sight of the goals that were found in the report. Better health, well-being, high-value health care, and a strong science and technology. These are not, in fact, partisan issues. They haven't been partisan issues. In fact, they've been issues upon which agreement has been reached year after year, whether it's 21st century cures, whether it was macro, whether it was chip. There's a long history of the two parties coming together around these issues. They are also found as the guiding principles for much of the work that has been underway for years, much of the work that Mark led at CMS and others have in fact pursued. And as the governor has pointed out, the federal government is not in fact alone in these efforts, nor are they alone in terms of the challenges that we are all facing. The states and the private sector have led efforts for years and should in fact be given every opportunity to continue and to receive the support that they need in order to continue. Our priorities at paying for value and moving away from fee-for-service, as has been pointed out, is exactly the right direction. It is a model that has made all the wrong decisions in terms of caring for patients. Empowering the individual and the provider, as we talk about in the paper, and seeking out the best result for those patients, and moving things back to our community. Again, as the governor has pointed out, much of the work that needs to go forward, in fact, will occur at the community, where they, in fact, can test out these new strategies and, in fact, look at the broad array of services and supports that individuals need. We've talked about the tools that are necessary to create the opportunity to target locally. And the determinants of health, as the governor has pointed out, are not simply the healthcare services that we traditionally provide, but involve things like housing, things like nutrition programs that in fact support many individuals. All those and transportation services are all part of these broad array of determinants of healthcare that need to be taken into consideration. And whether it's through the Medicaid program in the managed care environment where risk is involved, whether they've taken the opportunity to do that, is in fact part of the strategy going forward. There are risks as well that we need to take care of and need to be alert to. A long history of making sure that these individuals who are in great need and in fact very often are left to their own devices and trying to navigate the system, which would suggest, as we have in the paper, the need for transparency. The need for people to be able to understand how to navigate that system and essentially provide information that allows them to choose among services and the continuous learning needed by our providers. But more importantly, at least to me in the short run, that I would point out in the paper, is that in order to take on these challenges, which have been amply described by Victor and by Mark and by the governor, we need a workforce that in fact is prepared to take on a different healthcare system, a different delivery system, a different financing system. We need a workforce, given our demographics, that is diverse, that is multidisciplinary, that is team-oriented, and adept at data analysis and at informatics. A group of individuals that know how to work collectively together to care for the patient. The silos that have existed in the past between professions, in fact, cannot be sustained in an environment when, in fact, we have to navigate a very complicated system for our patients and help them provide the information that they need. Our training program, particularly for nurses, for physicians, in particular, need to be focused on coordinated and team-based care. We can't simply wait to someone to get into practice to orient them to the value of working with teams in caring for their patients. So again, recognizing the full array of services and the skill set of all the individuals that serve as patients today is enormously important and has to begin at the most basic level in terms of our training programs. We need to incentivize our education programs to foster those skills necessary for collaboration with their colleagues. And again, progress with respect to team-based care is not the responsibility of the federal government. It calls on states in terms of programs. It calls on accrediting bodies. It calls on professional associations, our colleges, our residency programs to find these new pathways to train, to move people into the community and out of acute care settings, into communities where people want to be cared for, and provide those opportunities for training and for collective work. And again, I would underscore that while the discussion around healthcare seems to be polarized at the moment, the policies that are discussed in these 19 papers are in fact a roadmap. They are a layout for how we can progress. They are not partisan in terms of solutions. We had the opportunity to spend time on the Hill last week and beginning to talk with members about these issues and find common ground and common purpose in moving forward in terms of these issues. The recommendations are in fact accessible and they are actionable. In fact, these are things that can move forward. Solutions will not be quick. As the governor points out, these will take a long-term, committed response across the board in terms of the financing programs, in terms of the organization of the delivery system, the reward system that we set up, the ability to track what in fact is measurable and what needs to be measured, again to the point where we've had a plethora of measures, but making sense out of what those metrics are and reducing them so that those in practice can in fact manage the information and in fact report on the things that matter, because what counts gets counted. And so again, the report identifies those opportunities and identifies a number of strategies that can be put in place at the local level, at the state level, and at the federal level, because in fact the balance of changes really go across all of those activities and really must be looked at in whole at all of those strategies. Senator?